season.
What's the logic of that? About it, right?
It wasn't much of a game, was it? No, it hadn't been much of a season this year or last year either.
Heck, I knew it was going to be a bad game, but I had tickets, so I went anyway.
It wasn't much of a game, was it?
Yeah, I thought we'd lose, but I had no idea we'd lose that badly.
You still want to go to next week's game after that one?
Yeah.
Jim?
Hey, are you okay?
Are you okay?
What would you do if this happened to one of your friends or a member of your family? Could you help? Some days, someone close to you may have to depend on you to know what to do, to think quickly to save their life. A choking person can die right before your eyes if you don't act immediately. Most people will try to help a person who is choking, but that help may be in vain if they don't know what to do. In the next few minutes, we are going to show you what to do, how to give first aid to the choking victim. Foreign body obstruction of the airway accounts for hundreds of deaths each year. Many of these deaths, however, could have been avoided had someone at the scene known how to properly handle the situation. This type of first aid is something that everyone should know. You don't have to be a doctor or even in the medical profession to learn these simple techniques. In this program, we are going to show you how to help a choking victim. Pay close attention. It may help you save a life. First of all, we're going to give you some basic information about the airway and how airway obstructions can occur. A foreign body can block the airway, or any structure forming the airway can itself block the airway. In other words, anything from a bite of food, a wad of gum, a toy, to whatever can stick in the throat and cut off the air supply, or a person can get choked by his own tongue. The tongue blocking the airway is the most common cause of airway obstruction because the tongue is attached to the jaws. And any condition that leads to unconsciousness or loss of tone in the muscles of the jaw can cause the tongue to fall towards the back of the pharynx and obstruct the airway. There are several other causes of airway obstruction, such as trauma, swelling of the tissues of the airway as in infections, burns, and smoke inhalation, bilateral vocal cord paralysis, strangulation, and drowning. But in this program, we are going to focus on foreign body obstruction, where emergency airway management is of key importance for safety in homes, restaurants, or even on the job. The first step in this procedure is to recognize a foreign body obstruction. Because early recognition of this condition is the key to helping a choking person, it is important to differentiate this emergency from the other conditions which also cause sudden respiratory failure, but which must be managed differently. Such conditions include heart attack, drug overdose, and stroke. Foreign bodies may cause either partial or complete airway obstruction. With partial airway obstruction, the victim may be capable of either good air exchange or poor air exchange. With good air exchange, the victim can cough forcefully, although frequently there is wheezing between the coughs. As long as good air exchange continues, the victim should be allowed and encouraged to persist with spontaneous coughing and breathing efforts. At this point, you should not interfere with the victim's attempts to expel the foreign body. A victim may have poor air exchange at the onset, or he may have good air exchange which progresses to poor air exchange. Poor air exchange is indicated by a weak, ineffective cough, high-pitched noises while inhaling, such as a crowing-like noise, increased respiratory difficulty, and eventually cyanosis, in which a victim literally turns blue because the oxygen in the blood is depleted. At this point, the partial obstruction should be managed as though it were a complete airway obstruction. In the conscious victim, complete forward airway obstruction is easily recognized by the victim's inability to cough or speak. Sometimes the only response from such a victim is a panicking look while gasping for air. The victim may also use the distress signal for choking, clutching the neck. He may appear dusky in color and show an exaggerated effort to breathe. However, movement of air will be absent. Prompt action is urgent while the victim is conscious. If the object is not expelled within a few moments, the oxygen in the lungs will be depleted. The brain fails to get oxygen, and unconsciousness will occur. Death will follow rapidly. Now that we've shown you how to recognize a foreign body obstruction, we want to show you how to handle such an emergency situation. 3 manual maneuvers are recommended for relieving foreign body airway obstruction: back blows, manual thrusts, and finger sweep. We are going to describe each maneuver with a recommended position and method of application. The back blow is probably the most common method used when trying to dislodge something that is stuck in the airway. The back blows consist of a rapid series of 4 sharp blows delivered with the heel of the hand over the spine and between the shoulder blades. They may be administered with the victim sitting or standing and should be applied forcefully in rapid succession. Each back blow should be delivered with the intent of relieving the obstruction without having to complete the full series. To deliver the blows properly to a standing or sitting victim, position yourself at the side and slightly behind the victim. Then place one hand on the chest to support him. Whenever possible, the victim's head should be lower than his chest to make use of the effect of gravity. Deliver 4 sharp blows with the heel of your other hand over the victim's spine between the shoulder blades. The second maneuver recommended for relieving foreign body airway obstruction is the manual thrust. Manual thrusts consist of a rapid series of 4 thrusts to the upper abdomen or to the lower chest. Manual thrusts force air out of the lungs, creating an artificial cough intended to dislodge the foreign body from the airway. As in back blows, deliver each thrust with the intent of relieving the obstruction without having to complete the full series. To properly administer abdominal thrusts with the victim standing or sitting, position yourself behind the victim and wrap your arms around his waist. Next, grasp one fist with your other hand and place the thumb side of your fist against the victim's abdomen in the midline between the waist and the rib cage. If the victim is sitting, use the chair for additional leverage if possible. Then press your fist 4 times into the victim's abdomen with a quick inward and upward thrust. You can even perform this maneuver on yourself if you choke when you're alone. Simply press a fist into the upper abdomen with a quick upward thrust, or lean forward and press the abdomen quickly over any firm object, such as the back of a chair, table, or porch railing. An alternate technique to the abdominal thrust is the chest thrust. This technique is particularly useful when the victim is so big that you cannot get your arms fully around the abdomen, or when pressure applied directly to the victim's abdomen is likely to cause complications, as in advanced pregnancy. To administer chest thrust to the standing or sitting victim, position yourself behind the victim. Place your arms directly under the victim's armpits and encircle the victim's chest. Place the thumb side of your fist on the middle of the breastbone, but not on the margins of the rib cage. Then, grasp your fist with your other hand and exert 4 quick backward thrusts. Looking back on the 2 methods we've just discussed, back blows produce an instantaneous increase in pressure in the respiratory passages, which may result in either partial or complete dislodgement of a foreign body. And the manual thrusts produce a more sustained increase in pressure in the respiratory passages and may further assist in the dislodgement and movement of the foreign body. But the combination of these two techniques appears to be the most effective method of clearing upper airway obstruction rather than isolated use of one technique. Now that we've shown you the techniques for clearing an obstructed airway, let's go over the sequencing of procedures for helping a conscious victim. Remember, immediate recognition of airway obstruction and proper action are essential. First, identify complete airway obstruction by asking the victim if he is able to speak. Next, deliver 4 back blows in rapid succession. Then, if necessary, perform 4 manual thrusts. Repeat the 4 back blows and 4 manual thrusts until they are effective. Now, let's ask that question again. Could you help now?
Can you talk? Hang on, I can help. Here. All right now, you breathe? All right?
Yeah.
Okay. Hang on.
Thanks a
that's
lot.
okay. Try to sip a little water though. Okay, you'll be okay now. Gee, that scared me too.
Scared me to death.
Glad you're okay.
Boy, saved my life.
You
buddy.
may be saying to yourself right now, that's not so hard. But what would you do in the event of an infant or small child choking? Relief of foreign body airway obstruction in infants and children is achieved through a combination of back blows and chest thrusts. Abdominal thrusts are not recommended in infants and children because of their potential danger of injury to the abdominal organs, especially the liver. If the victim is an infant, straddle him over your arm with his head lower than his trunk. The head must be supported with a hand around the jaw and chest. You may also want to rest your forearm on your thigh for additional support. 4 back blows are quickly delivered with the heel of your hand between the infant's shoulder blades. Be very careful, since obviously much less force is required. Immediately after administering the back blows, place your free hand on the infant's back so that he is sandwiched between your 2 hands, one supporting the neck, jaw, and chest, while the other is in a position to support the back. While continuing to provide support to the head and neck, the infant is turned and placed on your thigh with his head lower than his body. Deliver 4 rapid chest thrusts, using only 2 fingers instead of the heel of your hand. Remember, you use much less force when performing chest thrusts on an infant. You don't want to inflict internal injuries. If the victim is a child, too large to straddle your forearm, then kneel on the floor and drape the victim across your thighs, keeping his head lower than his trunk. The 4 back blows can be delivered with somewhat greater force than that used with the infant. With his head and back supported, roll the child over onto the floor and deliver 4 chest thrusts, using only the heel of one hand. Now, another situation we need to discuss is the unconscious victim.
No, I only have 10. I didn't even start. I only have 2. My partner. Mary. Man. I know, but I have some partners. I don't know who he is. Yeah. Some weird kid in my social studies class. You know his name? Some boy. Yeah. How many pages do you have left? Cindy, what are you doing? Cindy. Come on, stop it, Cindy. Cindy. Mother. Mother.
What would you do if you were faced with this situation? Could you help? In the case of an unconscious victim that is lying down, your positioning is very important when applying the two manual maneuvers we've described. When delivering back blows, first kneel and roll the victim onto his side, facing you, with his chest against your thigh. Then, deliver the 4 sharp blows to the back. When applying abdominal thrusts, turn the victim on his back and put your knees close to his hips. It doesn't matter which side you're on. Then, tilt the victim's head up to open the airway. Next, place the heel of one hand against the victim's abdomen, with the other hand on top, in the midline between the waist and the rib cage. Move forward so that your shoulders are directly over the victim's abdomen, and press into the victim's abdomen with quick inward and upward thrusts. Do not press to either side. You may also use an alternate position when helping a victim lying down. Instead of positioning yourself alongside the victim, straddle the hips or one thigh of the face-up victim. Then perform the abdominal thrusts as just described. Each position has its advantages. At the victim's side, the rescuer has more maneuverability and is in position to do other procedures such as chest thrusts, back blows, and finger sweeps. On the other hand, only the abdominal thrust can be performed while astride the victim. But in this position, the rescuer has a natural mid-abdominal position and is thus unlikely to direct the thrust to the right or left, which could result in liver or spleen damage. When applying chest thrusts, place the victim on his back, kneel close to his side, and tilt his head up to open the airway. Then, place the heel of your hand on the lower half of the sternum by following these steps. With the middle and index fingers of the lower hand, locate the lower margin of the victim's rib cage on the side next to the rescuer. Run your fingers up along the rib cage to the notch where the ribs meet the sternum in the center of the lower chest. With the middle finger on the notch, the index finger is placed next to the middle finger on the lower end of the sternum. Then place the heel of the other hand on the lower half of the sternum and just next to the index finger, which is next to the middle finger that located the notch. The long axis of the heel of your hand should be placed on the long axis of the breastbone. This will keep the main line of force of compression on the breastbone and decrease the chance of rib fracture. Then place the other hand on top. Now, exert 4 quick downward thrusts that will compress the chest cavity. Again, the combination of back blows and manual thrusts is the most effective method of clearing an obstructed airway. But in the case of an unconscious victim, another method is added: manual removal of the foreign body from the airway. If you can see a foreign body in the mouth, then remove it with the fingers. With the head up, open the victim's mouth by grasping both the tongue and lower jaw between your thumb and fingers and lifting. This action draws the tongue away from the back of the throat and away from a foreign body that may be lodged there. This alone may partially relieve the obstruction. If you are unable to open the mouth with this method, open it by crossing your finger and thumb and push the teeth apart. Then, insert the index finger of your other hand down along the inside of the cheek and deeply into the throat to the base of the tongue. Then use a hooking action to dislodge the foreign body and maneuver it into the mouth so it can be removed. Sometimes it is necessary to use the index finger to push the foreign body against the opposite side of the throat to dislodge and lift it. Be careful not to force the object deeper into the airway. If you can't see it, then a combination of back blows and manual thrusts may dislodge it so that you can remove it with your fingers. Manual removal of foreign bodies can be very effective, but there are a couple of drawbacks to using this technique. First of all, it is practically impossible to manually remove a foreign body from the mouth of a conscious, struggling person, so don't try it. Chances are that you would do more harm than good. And in some cases, especially with infants and small children, an adult's finger may force a foreign body deeper into the throat and cause complete airway obstruction. Now, let's go back to this situation. What would you do? First of all, you should call for help. Then open the airway and attempt to ventilate. If you are unsuccessful at ventilation, then apply for back blows. Apply for manual thrusts. Apply the finger sweep. Then reposition the head, open the airway, and attempt to ventilate. If the victim cannot be ventilated, then repeat the sequence of back blows, manual thrusts, the finger sweep, and ventilation until successful. Not all emergency situations like this one end on such a happy note. If the mother had not known what to do, her daughter would have died. So make sure you know what to do in an emergency situation. If you know how to manage a foreign body obstruction, you're better off. You'll be thankful if you ever have to use what you've learned, and lucky if you don't.